yes, there is a formal way of, diagnosing and, treating bipolar disorder. So it's very important that when you walk into a psychiatric setup or a psychological setup, the first and foremost diagnosing, testing tools are that you do a basic case history and a mental status examination for the patient, followed by then, you have your rating scales and so many things, and not just, be based on objective rating scales, because I have to, as a mental health professional, I have to, talk to the client, talk to his family members around. So apart from what just the client is also feeling, what their immediate family members also, feel regarding that particular person, because they've known him the best. Taking that also into consideration is very, very important. Now, in there is something that I did not mention. There is a milder version also of bipolar, that which is also called like dysthymia or cyclothymia. These are again technical words. So dysthymia means wherein you're only and only depressed, but to a very little level, wherein you are depressed throughout the year, but you're still able to manage your work. You're not feeling distressed about managing your work. And there is another thing called cyclothymia, which is again a very milder version of bipolar disorder, wherein again you have your phases of feeling sad and feeling happy, but you're still able to manage things. But when this goes beyond control, so yes, these there are some of these ways of diagnosing it. So first it has to be correctly diagnosed, and then based on the intensity of the diagnosis. So I might, again, if I'm undergoing dysthymia or cyclothymia, I might recover from extensive therapy. I might, but again it depends on the how the client is reacting to the therapeutic process. But if the intensity of the disorder is to a level wherein no therapy can work, nothing can work in this, so then medications are required. In fact, medications are very important, because sometimes, just doing therapies or counseling might not be suffice at all. So if you're not in the correct frame of mind, if you're not basically in your most calm stage, wherein you can listen to the therapist, wherein you can follow all the things that are being said to you, then the entire therapy becomes meaningless. So it is very important, especially in the case of bipolar disorder, that you take your pharmacotherapy and psychotherapy hand in hand. And pharmacotherapy is very important if the intensity is high.